Hello everyone, welcome to our channel. Today let's discuss Anesthesia INICET papers year wise, all the questions and answers. Yes, let's start. First is 2017 paper. First question: a 40-year-old female with burns over her abdomen, both limbs, back, present after 8 hours. Which of the following formula is used for the calculation of fluid infusion? First thing we have to notice, she is presented after 8 hours. Yes, first 8 hours we will give 1 ml per kg. Next 16 hours we will give 1 ml per kg into the percentage of the total body surface area that is burnt. Okay. Now our patient is presented after 8 hours. So the first 8 hours we have to give 1 ml per kg. But now after 8 hours means she already missed 1 ml per kg in first 8 hours. So we have to give total of 2 ml per kg in next 16 hours only. The preferred solution is lactated linger solution, RL. Okay. This is the formula. They have asked the formula. This is the formula, that is 2 ml per kg into total body surface area for next 16 hours. This you have to calculate the percentage of total body surface area. You have to calculate. You will learn the calculation in surgery part. Here you have to see the how to resuscitate. Okay. 35-year-old woman was brought to the casualty ward with a history of road traffic accident and had trauma. Her eyes opens to the pain and she moans can localize the limb towards the pain stimulus on the right hand and both the legs in extended posture. Calculate her GCS. Yes, let's see. First write the normal value EVM. E is 4, 5, and 6. Let's see. 4, 5, 6. This is the normal. This is E is for eye opening. This is verbal. This is motor. Her eye opens to pain they have given. That means she is opening her eyes to pain. Eye opens normally. That means I can give her a maximum 4. Eye is opening to the verbal. Verbal, if I talk or if I call her name, then only she opens her eyes. That means I can give her 1 less than the 4, that is 3. If she opens her eyes, if I when I give a painful stimulus, then it means 2. If she is not opening her eyes even after painful stimulus, then I will give a 1, that is the least number. If you can't elicit, then you will give a cannot be elicited, that is we will give cannot be tested, not tested, NT. Okay. Okay. Now E is painful stimulus. That means E is 2. E is 2. Whereas she moans and can. Okay. She moans means verbal. She is doing some type of like that type of voice. If verbal, if she can nicely speak, we'll give 5. That is good. If she speaks some things but she is confused, then you will give a 4. If verbally, if she tells 1 or 2 words, then you can give a 3. If she is doing some noise, that is she moves, then you can give 2. If she doesn't give any verbal response, then the least is 1. She localizes limbs towards the painful stimulus. See, in M6, tell her to lift her right hand. She is lifting. That means I can give. She is obeying my command. Then that means good. In M5, she localizes to the pain. Here they are telling she is localizing. She is able to localize the limb. It's right hand or left hand. Will not consider. We have to consider the most possible thing she is doing. She can localize the pain. So she is having a M5. What is M4? Let's see. M4 is when she withdraws to the pain. She is not localizing the pain, but she is withdrawing her hand. And when you give a painful stimulus, that means 4. If she is doing abnormal flexion, that is flexion decorticate posture, then you give 3. Okay. Abnormal extension, if she is doing, that is decerebrate, then you give 2. See, flexion, sometimes we get confused. Flexion is 3 or extension is 3. Flexion is 3. You have to remember. First, they will do flexion. Okay, that means flexion is also a type of action when you withdraw, right? Hmm? You will not extend as such. But first thing is flexion. So flexion is given a good number, that is 3. Whereas extension is 2. Here, extension means decerebrate. Sometimes we get confused. Extension is decerebrate or decorticate. Extension is nothing but E. There, if so many E's extension, you will get a decerebrate. Here also so many E's. See, decerebrate. Here so many E's. That means extension. Okay, you can remember like that. And extension is 2. If no motor response, then 1. See, non-testable, then you have to give NT. Okay, E we are giving 2, E2, E2, V2, M5. 5, 6, 7, 8, 9. So answer is 9. C, 9. E2, V2, M5. Next question, third one. Patient who was on ventilator and being ventilated for past few days suddenly pulls out the endotracheal tube. What is the next step? If you have worked in a ICU sector, you will know some of the patients who were in the ventilator for many days, then suddenly one day they themselves pull out the endotracheal tube outside. Next immediate step is we have to see whether she can or he can spontaneously breathe. The 50% of the patient who self extubated, they will not require any of the ventilator support. They can breathe spontaneously, so we will check for a spontaneous breath. But if patient can't breathe spontaneously, then we have to do reintubation. So reintubation is the first next step. No. Oxygenate and reintubate, no. We don't know about the oxygen saturation, right? Then why to give oxygenation? It's not required. Start CPR, no, not necessary. The patient is conscious, and then why to start CPR? It's not necessary. Okay. Fourth one, the time required for pre-oxygenation before tracheal intubation. Actually, ideal time is 3 minutes. Why 3 minutes? It's for the tidal volume breathing of 3 minutes. That is 3 minutes is required. Okay. Next, fifth one. Fifth one, the nerve fiber least susceptible for local anesthesia. This is the controversial question. If this question comes in exam, you should be thinking in terms where which one to choose. Yes, the least susceptible according to the anesthesia, most of the textbooks, it's C only, the least susceptible. Most susceptible is B, whereas A comes in between. It is a cab. Okay, cab is C for least susceptible, A for intermediate, and B for most susceptible for local anesthesia. That is controversial question, but you have to remember either of the one. See, some again on textbook of physiology, they have given local anesthesia, that is CBA. It is not cab, right? It is CBA. C is most susceptible, B is intermediate, and A is most susceptible they have given. But I guess that is not required either of. If you remember both of them, you will get confused for sure. So only remember one thing. You remember anesthesia peoples only. So least susceptible or most resistant to local anesthesia is C, then A, then B. B is most susceptible. It's not resistant. Okay, it's not resistant. That is least resistant to local anesthesia. Sometimes they give other scenario where they will give that the patient was overlaying on his arm like that pressure. When pressure comes, it is ABC only. A B C D is the no ABC. A is for most susceptible fibers, then B, then C. That is C is the least susceptible. In for hypoxia, it is BAC. BAC. Okay. Next, coming to which of the following can be used as a IV induction agent. That is the we can use lorazepam for the IV induction agent. Okay, it is a benzodiazepine that can be used for induction of anesthesia. Midazolam is preferred among the benzodiazepine, but midazolam is not given in the option. Okay, so answer is lorazepam. Which of the following is correct sequence they have asked? This is actually important question because many a times they ask on the BCLS, ECLS, ACLS protocols. Okay, now see the assess the patient response. Yes, correct. You have to assess the patient response. Okay, when you see one some patient, you have to assess for the patient response. Next, activate ERC's emergency response system. Check for carotid pulse. Yes. If absent, then you can start CPR. Yes, correct. Check the carotid pulse. Start CPR. Call for help. No, call for help should be in the first try. When you see some patient is lying here, first you have to see the safety of the patient. Okay. Safety of the patient is not given in any of the options. So let's ignore in this question. Okay. Not in the real life scenario. You have to see the safety of the patient. Then you have to, if it's not safe place, then you have to shift the patient to the other safer place that is there. After that, after assessing the safety, then you have to see the patient's response. Okay, which has a patient response here. But in any other option, patient response is given second. It's not, because assessing the patient response is very important before defibrillating, isn't it? So C option, let's rule out. Next again, okay, second, first only A option has patient assessing the patient response. Okay, after that, if patient is not responding or something, you have to call for help. Okay, help, you have to ask for help now. So any answer, second one, B option, call for help, that is given third. It's actually a priority. You have to call for help before checking the carotid pulse. Okay, so option B is also ruled out. Call for help, good. Then activate the emergency response system. Then what you have to do, if let's see, if patient is unresponsive, shout for help. Yes, that is correct one. Then assess for breathing and carotid pulse. If everything is normal, okay, he might have fell down or something. Okay, everything is good. If he is not breathing, okay, you have to any of this. If he is not breathing or no carotid pulse, then you have to active emergency response system. Okay, if patient is not breathing but pulse is present, so you have to give now a rescue breaths because pulse is present, right? So he is not breathing, that means you give a 10 rescue breaths within a minute. So that means every 6 seconds you have to give one breath. So after giving the breath, check for pulse now. For every 2 minutes you have to check the pulse. Okay, if no pulse is also now, when you saw the patient, his pulse was there, but after 2 minutes when you checked, the pulse is not there, so you have to immediately start CPR. But in other scenario, if he is not breathing, no pulse, you have to start CPR, then use external defibrillator as soon as it is available, because you have already called for help and active emergency response system also. Okay, check for the rhythm. If it is a shockable, give one shock and continue CPR. If it is non-shockable, then you have to resume CPR. This you have to do continuously, check and continue the CPR. Okay. D. Option K. Start CPR, then activate ERS, then defibrillate, check carotid pulse. Before starting the CPR, only you have to see the carotid pulse, not after starting CPR. After starting CPR also you have to check, but before starting, this option should be full. So only option A is good enough here. Okay. Okay. Thank you.